Assalamualaikum. I am Taiba and you are watching your own channel Audiovisual Books. With the editorial section of our audio recordings, I am here. Path of Disaster. Today's Dawn editorial. It is. And let's start. The nightmare scenario that doctors in the country had warned of in April, in fast approaching. At the time, senior doctors had written to the government urging it to reconsider its decision to allow congregational prayers during Ramadan and had said that number of COVID-19 patients in need to of urgent medical care would expand exponentially if strict distancing was not enforced. More than a month later, with the government lifting most lockdown restrictions, those fears are turning into a grim reality. According to the official data, major hospitals across the country are rapidly running out of capacity. With over 31,000 cases in Karachi alone, private and public hospitals in the metropolis are becoming overwhelmed. The Sindh Health Department's data shows there are no beds vacant in ICU's unit in Karachi, except for six at one hospital. The Pakistan Medical Association had said and the major hospitals in Karachi had stopped admitting critical patients. Even the government's Pak and Negaban app showed that ventilators were available in one hospital only, while others were running on limited capacity. In KP, the chairman of the Provincial Doctors Association expressed fears that the province was rapidly heading towards a situation where there will be no space in hospital to take COVID-19 patients. According to him, most of the Peshawar's hospital had run out of beds, with patient relatives running from pillar to post in search of a health facility. One hopes that the harrowing number of the infected and the dead that were once seen in Italy as COVID-19 peaked, they are not reflected in statistics in Pakistan, where doctors are being forced to refuse patients and make different choices in rationing ventilators. As this situation unfolds, Prime Minister Imran Khan has forecast that Pakistan will hit its peak in July or August, whereas earlier NCOC had Asad Umar had said infections would peak in June. With no prevention strategy inside and no consensus and between the federation and the provinces on a way forward, it is clear that Pakistan is hurtling toward a COVID-19 catastrophe at full throttle. The Prime Minister, who has disturbingly downplayed the coronavirus as a type of flu, is ironically today expressing his frustration at the lax attitude of the people who are ignoring SOPs. In a televised message this week, Mr. Khan said and that people who are careless about SOPs will endanger themselves, the elderly, the immunocompromised, and in turn the country. A contrast to his earlier messages that people should not panic and that we were much better off than other countries. Sadly, few in the government are aspiring to follow New Zealand, which now has zero new cases, or Vietnam, which reported zero deaths. The authorities must look inward and reflect on where they have wrong, where they have gone wrong, and what message has been conveyed to the public. They must remedy and their mistakes. All alarm bells are ringing loudly. The government must listen. Published in Dawn, June 10, 2020. Thank you for listening. Please subscribe to get daily updates. Thank you.